As the body ages, its ability to process and absorb nutrients becomes less efficient, and vitamin D is no exception. While this nutrient plays a vital role throughout life, its importance becomes even more pronounced in older adults due to physiological changes that reduce the body's natural capacity to maintain optimal levels. With age, the skin thins and produces less vitamin D in response to sunlight, kidney function declines and hampers the activation of vitamin D into its biologically active form, and the digestive system becomes less adept at absorbing fat-soluble vitamins like vitamin D. These changes create a perfect storm of vulnerability, making older individuals more susceptible to deficiency and potentially more in need of supplementation to support healthy aging at the cellular level. Vitamin D metabolism is complex, involving several steps that must work efficiently to yield the active form the body uses, known as calcitriol. First, the skin synthesizes vitamin D3 when exposed to UVB rays. This vitamin D3 then travels to the liver, where it is converted into 25-hydroxyvitamin D, the storage form measured in blood tests. Finally, it must pass through the kidneys to be converted into calcitriol, which is responsible for regulating calcium balance, modulating the immune system, and influencing cellular activity, including gene expression. In older adults, each stage of this process tends to slow down. Reduced sun exposure, impaired liver and kidney function, and lower dietary intake all contribute to a drop in circulating vitamin D levels, often without any clear symptoms until a deficiency becomes severe. But the implications of low vitamin D in aging go beyond weak bones. Increasing evidence suggests that vitamin D influences processes involved in biological aging itself, including inflammation, immune surveillance, DNA repair, and even telomere length. These telomeres, often seen as internal clocks that mark cellular age, appear to shorten more slowly in individuals with adequate vitamin D levels. This finding, observed in multiple population studies, supports the idea that vitamin D may serve not just as a skeletal protector, but as a guardian of cellular longevity. For older adults, whose telomeres are already shorter due to years of replication and exposure to oxidative stress, ensuring optimal vitamin D status may help preserve remaining telomere length and contribute to better cellular function over time. Immune health is another crucial concern for older adults, and here too, vitamin D proves especially important. As we age, the immune system becomes less robust, a phenomenon known as immunosenescence. This includes both a decline in the function of innate immune cells, our first line of defense, and a deterioration in adaptive responses, our more specialized, learned immunity. Vitamin D helps support immune regulation by enhancing antimicrobial peptides and promoting anti-inflammatory cytokine activity while reducing the overactive inflammation that can harm tissue. These effects are particularly relevant in aging, where chronic low-grade inflammation, sometimes called inflammaging, contributes to a higher risk of many diseases, including cardiovascular disease, type 2 diabetes, and neurodegenerative disorders. All of these factors support the growing consensus that older adults often need more vitamin D than younger individuals. While the recommended dietary allowance, RDA, for adults over 70 is currently 800 IU per day, many experts suggest that a daily dose between 1,000 and 2,000 IU is more appropriate to achieve serum 25 OH-D levels that consistently fall within the optimal range of 30 to 50 nanograms per milliliter. Supplementation at this level has been found to be both safe and effective, particularly when taken with a meal to enhance absorption. It's also worth noting that vitamin D's fat-soluble nature makes it more readily absorbed when consumed alongside healthy dietary fats, another simple yet effective strategy to support bioavailability in older adults. Perhaps the most encouraging aspect of this discussion is how manageable the solution is. Unlike some health interventions that require drastic lifestyle changes or invasive treatments, maintaining sufficient vitamin D levels can often be achieved with small, consistent habits. Taking a daily supplement, choosing fortified foods, and making the most of sunlight exposure when it's available. These actions are not only accessible but empowering, offering older adults a proactive way to support their cellular health, strengthen their immunity, and potentially slow the aging process at its root. In sum, aging naturally increases the body's need for vitamin D, not just because of the weakening of bones or the fading strength of muscle, but because of deeper biological changes that affect how nutrients are absorbed, metabolized, and utilized. Addressing this need through thoughtful supplementation and awareness is a practical and evidence-backed strategy that can contribute to better health outcomes, enhance quality of life, and even a slower biological clock. As science continues to explore the intricate relationship between nutrients and aging, vitamin D stands out as one of the most impactful and one of the most easily optimized components of healthy longevity.